See.
So we have COVID, our fiscal year 2020 ends June 30th. That's our year of COVID. And then we have fiscal year 2021 starting July 1st, which will also be a year of COVID. But we have to set the budget. The budget has to be addressed. How's that affected our employees? One of the questions was, have we had to do layoffs and how many?
Well, that's right. Your question was 10 questions rolled into one.
Right. I'm just now breaking them apart
Yeah,
for you.
gotcha. Well, thank you. Yeah, because you asked me about morale and the layoffs and morale, and just just how people are feeling in general. And again, I was speaking to roughly 150 of our vice presidents, our directors, our supervisors, our managers, all of those folks that are leading this organization through this pandemic, and I worry about them. I do worry about their morale because not only are they still running a hospital and doing their regular jobs, but they're also now, having to take on extra responsibilities associated with the pandemic. So I know they're tired, and I was commenting that, it used to be that as a healthcare worker, you come to work, you give it your all. And you're tired at the end of the day, but you feel a great sense of accomplishment and reward of helping other people. But then you go home to your home, where hopefully it's peaceful, you're with family, you're re-energized. You get to talk about, how the kids' day was at school, but that's all changed too. And so, many of our employees, our leaders, our parents, their spouses, and now they go home and are having to deal with all the challenges that folks are having now in their everyday lives. Their kids not being able to go to school, not being able to socialize, and dealing with just the emotional challenges that children have. So healthcare workers now, it's full time. The pandemic is consuming every aspect of their life. So we do worry about, how do we keep them energized? How do we support them? And fortunately, we have leaders like Diane, who that's what their passion is to really invigorate our workforce and to keep them motivated and enthusiastic. So, but it is a challenge. Our employees, they're tired. We're definitely working shorthanded right now. When we talk about, we have 45 employees that are quarantined home right now. Many of them are clinical folks, RNs, LVNs, CNAs, certified nurse assistants. We also, many of our healthcare workers, when the pandemic first broke out, they went on leaves of absences, taking care of an immunocompromised child or parent or daycare issues. And so our workforce has been hit hard. So we are, we're having to look to our existing workforce to work extra shifts, to work overtime, reaching out to the nurse registry companies that provide what they call travelers to us, which are very, very expensive. And you think about, we're paying a nurse right now, if they'll work an extra shift during a pay period, not only will we pay them time and a half for that, but we'll give them a $400 bonus just for working that shift. We're paying right now about $80,000 a month or per pay period just to support that extra shift bonus. And I'm so grateful to the nurses that are willing to do that because, again, they're tired, but they're still always at the top of their game. I mean, they still know that patient safety absolutely comes first, and we won't let nurses work beyond their capacity, and we call that fatigue. We do fatigue audits every single week to make certain, or monitoring to make certain that staff aren't working too much. So, but that's taken its toll on the organization. We have, as we've talked about, as virtually every hospital I know has had to lay staff off in response to the pandemic. The loss of revenue, there's the financial strain that it's put on the hospital. We've had to do the gut-wrenching, heart-wrenching task of letting people go for the long-term survival of the organization. So we've been very careful. Certainly we have not laid off bedside RNs or LVNs or people that are taking directly care of our patients. But definitely, you know, people, both leaders and staff that are in support positions, administrative positions. Again, very, very difficult. They're our friends, they're our colleagues. Many of them have worked here for many, many years, and it has really been gut-wrenching. We've laid off 53 of our employees during the course of this pandemic. That's certainly a fraction of what you've seen other hospitals have to resort to. St. Agnes reported about a month ago, it's actually a smaller hospital than Kaweah Delta, but they've laid off 175 people. Tulare Hospital, who's only operating 11 beds, laid off 44 of their employees. So you compare that to a 600 and almost 50 bed hospital laying off 53 compared to an 11-bed hospital laying off 44. Adventist Health is a health system, has laid off 1,000 employees. They reported that a couple months ago, and I expect we'll continue to see more layoffs. Going into this next year's budget, which will be presented to the board on Monday night for their approval, I can tell you that the overriding principle was the retention of jobs. That's what the motivation, the objective was, to do everything we could to keep jobs at the organization, to not have to lay off more people. And in order to do that, it is still going to require that we do some things that are going to be very unpopular, that are very uncomfortable, disconcerting to have to do. It is more than likely, it is absolutely probable, I'll say it's going to happen, but we won't be able to give a wage increase this year. And for the last several years, we've given wage increases that are averaging close to 3% across our entire organization. And we've, through Diane's leadership, we've really we spent a lot of time just carefully looking at the wage structure of virtually every position throughout the organization to make certain that we're highly competitive and attracting and keeping you know, the best and the brightest. And so we have an outstanding workforce right now, and but this next year we simply cannot afford to give a pay increase, which would generally cost us somewhere around $5 million to give that same 2.8% average pay raise.